Hi guys, Dr. Rahul this side, and today I will be discussing regarding a PSM subject, right? So I will be discussing mainly previous year questions and some important topics, right, that have been repeatedly asked in your upcoming exams. Almost we can expect like 25 questions in every um, paper, right? Previously, 20 questions were asked in your inicet, neet, right? And even in your UPSC CMS, there are 40 questions, right? It's a huge chunk, right? In FMG also there are similar number of questions. So these are important subjects. So we'll try to discuss this based on previous year questions and the important topics. Also, we'll take a separate session for your image based question. Okay, so nothing to worry about. So we'll start. Correct. Okay, so first question that has been asked in your recent exam is regarding data, correct? So they asked like is running. Okay. So they asked GCS is what type of data? Like we know that there are different types of data. Like one is nominal, correct? One is nominal, then another is ordinal, right? Nominal, ordinal, then there is interval, correct? Then there is ratio. So they asked what type of data is GCS. So first we'll understand that what are these data, correct? So first one is nominal data, right? Nominal means it is basically a qualitative type data, means naming something, right? Nominal, right? Like boys, girls, like so this I am naming a data. This is nominal type, correct? Ordinal is the data that you can rank based on their severity, or you can score them, or you can tell them like mild, moderate, severe, like this one. These are ordinal data. So basically GCS is ordinal data. By now you understood the concept, because GCS you can grade it, correct? You can grade mild, you can grade moderate, right? So this is an ordinal type of data. Interval, it is degree Celsius, means like you can say that these temperature ranges these to these, right? Say 36 to 37 degree, right? So this is interval. And ratio is, you know that this is something is to something, correct? So the question was about GCS. What type of data is GCS? It is ordinal data. Why? Because it can be ranked, like mild, moderate, severe. You can rank it, correct? Okay. Now there is an important concept known as test of significance, correct? Test of significance. This is repeated almost every alternate year. Like so, uh, there are two types of test of significance. One is parametric and one is non-parametric, correct? One is parametric, one is non-parametric. Do remember that parametric is for quantitative data and non-parametric is for qualitative data, correct? So parametric, the important ones are the examples, correct? The examples are t-test, mainly paired t-test or unpaired t-test, correct? ANOVA, these are the examples, right? So paired t-test for one group, this I will discuss later. Unpaired is for two group. For now remember it like this, right? Parametric, paired one group, unpaired two group, and ANOVA for more than two groups, right? And non-parametric tests are very tough names, like for example chi-square. This has been asked in your inicet, chi-square, correct? Then McNamara, right? Just remember these two. All the tough names are in this group. Non-parametric is mainly for qualitative data, right? So now we'll discuss about these two, parametric, this paired and unpaired t-test. What do you mean by paired and unpaired? Examples are often asked. Like paired t-test mainly in one group, that is when you measure the BP. Say for example you are measuring the BP, right, in boys, okay? In boys before and after taking antihypertensive. For example, you are measuring BP in boys or men before and after taking an antihypertensive. So you are measuring the BP in one group. So this is parametric. This one paired t-test, right? And unpaired is when you are measuring in two groups. For example, you are measuring the same thing in two groups. For example, in boys and also in girls, right? So this comes in unpaired t-test, right? Two groups, correct? And more than two groups, for example, boys, girls, and then elderly, then so this is more than two groups, then it will come under ANOVA, correct? So I just with example I just tried to this one, right? Next come an important section, biomedical waste management, right? This is I will say this is a hot topic because every paper there is one question regarding biomedical waste, correct? So first we will divide it into four criteria. One is yellow, correct? Next is red, next is blue, next is white. There is another color which I will tell about the codes, right? First is yellow. Okay, let me give the color coding. Yellow, correct? Red, so that you don't this one, blue and white. All right. So now yellow is mainly for infected things, right? Like this year in neet this came like a throat swab. The swab we will throw it in yellow because it is infected, okay na? So all infected materials like it may be placenta, it may be like throat swab, right? It may be blood or blood related products, everything will throw in this one, yellow, correct? Okay, so next one is red. So red, just remember three things: rubbers, tubes, and plastics. This we will throw in red. Okay, rubbers, tubes, and plastics. Okay, in red. Like you may say urine bag, red. Anything with blood in yellow. Right? Anything rubbers, tubes, or plastics in red. Folies, red. Okay. Now blue. In blue we will mainly throw glass, then implants we will throw, okay? Glass, implants, pacemakers, this we will throw in blue, correct? And next comes white we will throw sharps like needles, lancets, this all will go in white. Now there is another thing that is asked in your inicet, black. So in black what we will throw? In black we will throw the pepper, okay? Pepper is thrown in black, okay? So yellow, in yellow we'll throw the infected ones like the swabs, the placenta, or any human waste like this one. Even drugs, cytotoxic drugs, these all we will throw in yellow, okay? In red, rubbers, tubes, plastics like folies, okay? Folies is there. Urine bag, right? Blood bag, yellow. Urine bag, red, okay? In blue, glass implants. Okay, so blue we will throw glass implants and pacemakers. In white, sharps, needles, etc. And in black, pepper. Okay. Okay. So another question that came in your paper was Ebola virus. So Ebola. So Ebola, your case fatality rate you remember as 50%, right? Which diseases case fatality rate is 100%? It is with rabies. This has also been asked, and in your UPSC CMS paper it was given like Lissa virus 2. Okay, Lissa virus 2. So Ebola case fatality rate 50%, rabies has got 100% case fatality rate, and Lissa virus 2. Okay. Okay. And Ebola virus, yes, the thing that was asked that it can be transmitted from human to human. Human to human transmission is possible, right? human to human transmission is possible, correct? And there are different features like fever, body ache, nausea, vomiting, diarrhea, hemorrhage, left this one liver failure, renal failure, and one vaccine has come recently, rbsb GSOP vaccine, right? rbsp GSOP vaccine, correct? Okay, so next one came from the COVID, right? Okay, so next question is regarding COVID. So regarding COVID, what was asked is that uh, what is the percentage of alcohol in the disinfectant, right? Used for this one in the hand sanitizer, right? So actually it is 70% ethanol that is used as a disinfectant for COVID, right? 70% ethanol is the best answer, better than 60%, correct? If in option you don't get 70%, then you have to mark 60%, correct? And next thing is asked like regarding the uh, next thing is regarding the laboratory levels, correct? So just remember that in BSL3 virus isolation is done, right? So virus isolation is done in BSL3, correct? And in BSL2 the specimen handling is done, okay? Specimen handling like your serology test, then rapid antigen test is done in BSL2, and virus isolation for vaccine manufacturing purpose is done in BSL3. I think this is clear, correct? So I will repeat once again. So percentage of alcohol used in COVID prevention is 70% ethanol. It is better answer than 60%, correct? Laboratory levels BSL3 for virus isolation for COVID vaccine preparation, and BSL2 for specimen handling like serology test or rapid antigen testing, right? Another thing is asked like also remember 1% hypochlorite. Actually it is 1% sodium hypochlorite, okay? So 1% sodium hypochlorite, this is also used for this one COVID specimen disinfection, and also it is used for disinfecting blood spills. So disinfecting blood spills, correct? So 1% sodium hypochlorite is used for disinfecting COVID specimens and disinfecting blood spills. So remember it, right? Disinfecting. 1% sodium hypochlorite. It is used for disinfection of COVID specimens and also disinfecting blood spills in OT. So both these questions has been asked in your exam, correct? Now next one, post exposure prophylaxis for HIV is also important. So following a needle prick injury, first thing is immediate uh, washing of the site under running water, okay? And within 72 hours you must start the 3 drug regime. Tail drugs, these are old drugs. Nowadays these are not these drugs are not given. Actually nowadays is given M-tricitabine plus tenofovir plus another drug combination. This drug is not given, but in the option it was this drug only. So anyway, as per question, tenofovir plus efavirenz plus lemivudine, tail drugs, right? Next question was regarding different vaccines and their antibodies, right? In body. So for tetanus vaccine, the antibody level to be maintained in body should be more than 0.01 international unit per ml. This should be the antibody level for tetanus means the healthcare worker should maintain this much antibody to prevent tetanus, right? And for similar thing, this one is also asked HBs antigen more than 90 international unit per liter. This should be the level of antibody in our body to prevent this one, hepatitis B, correct? From COVID, another question was asked, like antibody testing of COVID depends upon. So antibody testing of COVID depends upon two things: past infection plus now asymptomatic at present, correct? Past infected and now asymptomatic. So this is the basis for antibody testing in COVID. Okay, this RT-PCR, correct? Okay. So yes, next topic is also important. It is about the Zika virus. Now, first, to talk about Zika virus, there was a chart that was given with a diagram, like So first, you must remember that it is transplacental. Okay, then sexual route is there. So transplacental sexual route is there, and most important thing, there is microcephaly. The microcephaly is seen in many other diseases like CMV, then many conditions, but Zika is one of them. But the main thing is that it is transmitted by mosquito. So in the picture, one mosquito was given. It is the Aedes mosquito. So these four things you remember. Okay, transplacental, microcephaly, sexual route, Aedes is related with the Zika. Okay, and this has been asked. This is very important topic. Next asked, the highest thermic effect. So thermic effect is the heat generated from the food intake. So highest thermic effect is seen with protein more than carb more than fat. So for protein it is almost 30%. For carbohydrate it is almost 8%. For fat 2%. So highest thermic protein is for highest thermic effect is for protein, which is almost 30%. Okay, followed by carb 8%, followed by fat 2%. Okay, then one worm is given which can be seen with your naked eye, so something like this. So it is actually Ascaris lumbricoides. Okay, Ascaris or roundworm. Okay, so they wanted the identification just, so worms are looking like these only. So just remember that when the posterior end is carved, it is male. Okay, and the treatment is albendazole. You know that. And fecal route, right, is the route of transmission. Chalo. Then something came as diseases under RBSK, राष्ट्रीय बाल स्वास्थ्य कार्यक्रम. Okay, so just remember the 5 diseases, because this has been asked in your this one also, UPSC CMS also. Vitamin A deficiency, vitamin D deficiency, SAM, goiter, anemia. So these are the 5 diseases under RBSK, and also there is some childhood defects, developmental disease, but in deficiencies there are only 5 deficiencies. Take a vitamin A, vitamin D, SAM, goiter, anemia. Just remember these 5 things, correct? Another important thing is dose of iron plus folic acid. Okay, for adolescents. So remember, in iron plus folic acids, the constitution of iron is 60 milligram, right? And folic acid is 500 microgram. 60 milligram iron, 500 microgram folic acid. Don't forget this. This has been asked in almost every exams, in FMG, UPSC CMS, in NEET PG, in inicet, everywhere. So iron is 60 milligram, folic acid is 500 microgram. Okay, daily. Next, ask the choice of contraception, right? Choice of contraception in female with heart disease. So contraception we will see at our gynae session, but here I will like to discuss the choice of contraception in female with heart disease is IUCD. Okay, in details we will discuss in our gynae session. Okay. Okay, so next important topic is MMR, correct? So from MMR the definition came. Okay, MMR is maternal mortality ratio. So the definition came as number of maternal deaths in population occurring in 42 days. Remember, number of maternal death in 42 days of termination of pregnancy by total number of live birth in population into lakh. Okay, so it comes like maternal death by live birth into 1 lakh population. Okay, next topic came as SAM. This is a pedia topic, but okay. So in SAM there are three criteria. First is weight for height is less than minus 3 standard deviation. Okay, mid upper arm circumference less than 11.5 centimeter and bilateral pedal edema which is symmetrical. Each and every word is important, right? First one is weight for height less than minus 3 standard deviation, mid upper arm circumference less than 11.5 centimeter, bilateral pedal edema which is symmetrical. For SAM we have to refer the child to the nearest health center. There they will manage their child's feeding program, and when they will discharge, the discharging criteria is different. When the child will at least come to minus 2 standard deviation, from here to minus 2 standard deviation, or from here to 12.5 centimeter, or there is no edema. In these three cases they will discharge the child. Okay, details we will discuss in pedia, right? Chalo. Also it is asked that in what may be the cause of seizure in a child, right? So remember, vitamin B6 deficiency or pyridoxine deficiency may cause seizure in child. Okay, and then they have asked like toxoids, which vaccines are the toxoids. Toxoids, you know, DT vaccine, diphtheria, tetanus, these are toxoids, correct? Live vaccines are yellow fever vaccine, MMR, okay, Japanese encephalitis. Well, these are live vaccines. Okay, what are killed vaccines? Pertussis is there, Japanese encephalitis killed, influenza killed, right? These are toxoids, correct. And there came an insect, I think, not an insect, actually mite came, right? Trombiculid mite. So actually how will I identify? See, how I remember that ticks are like hard ticks, soft tick, and then there is mite, and then there is flea, correct? So how will you identify them? So hard tick, H for head. So hard tick will have head. Okay, head is there for hard tick. Soft tick, no head, right? And in mite, the entire legs are so thick, correct? In mite, entire legs are thick, okay, and posterior legs are thin. This is mite, and flea remains flat, ekdom flattened. Okay, like this. This is a flea, correct? So this is a one way of identification. You can identify that the hard tick will have a head, soft tick no head, mite thick anterior and thin posterior legs, and flea is flattened. Okay, I will show you the images, right? Chalo. And then there are mosquitoes also that are asked. So remember, Aedes usually sit at an inclined position. They will make a triangle of 45 degree, like this way. In this angle they sit, Aedes, right? Culex will sit like this in a hunchback manner. Okay, mainly they ask Aedes only, and Culex and Anopheles, right? Oh, sorry, I did a mistake. Anopheles sit in a this one inclined manner. This is I mentioned Culex, and Aedes, Aedes will identify this is tiger-like stripes in its body, right? Tiger-like stripes. Okay. Culex in hunchback and Anopheles in an inclined manner, correct? And when you talk about the gametes, this is Plasmodium vivax and this is Plasmodium falciparum. So Plasmodium vivax and Plasmodium falciparum, when you see it, their gametes, Plasmodium falciparum has banana-shaped gametes or two dots, more than one dot you can say. Then this is Plasmodium falciparum. If there is one dot like this, one dot, okay, I hope you can understand that there is one dot is called Schuffner's dot. Schuffner's dot. So this is a Plasmodium vivax, right? Plasmodium falciparum has more than one dot or two dots or a banana shaped gamete. Okay. Okay. So yes. Next they asked about HPV genome and how from where the vaccines are derived. Okay. So this has been repeated twice, so this is an important topic, right? So remember the e gene knocks down retinoblastoma, okay, and the L gene, specifically L1, is used for vaccine manufacture. This is enough. This is your recent updates, okay. Your HPV genome, E gene will knock down retinoblastoma. This has been asked once, and L1 gene for vaccine manufacture has been asked twice. Okay, these two things you remember. Okay. Another question asks that if your hand is visibly soiled hands, then of course you have to do hand wash, and in that case only hand sanitizer is not beneficial. You have to wash your hand properly if your hand is visibly soiled. Okay. So another question is asked about Poisson's distribution. Poisson distribution is the discrete number of events that actually we don't have any idea that how many times it will occur, like a mo sitting in an emergency room has no idea what number of trauma patients will come. This Poisson distribution, right? Discrete number of events. Discrete, you will find this word, discrete number of events that occur in a fixed time interval, that we have no idea about that how many times it will occur or what are the actual number of events that are going to occur. Okay. Then there came what is range. So range, range is highest value minus lowest value, right? High minus low value. Like we may say there are few numbers like from 70, 71, 75, 85 and 100. So what is range? 100 minus 70. So range is actually 100 minus 70. So range is 30. Okay? 100 is the high value, 70 is the low value. Correct? Then there came the best method to study research studies, right? It is of course meta-analysis. So meta-analysis is the highest, okay, is the best, because what we do in meta-analysis, we compare, say we want to do a study, right? So for that study we will compare 300 previously studies done and then we'll derive at the conclusion. So obviously it will be going to the best study design, right? It's the highest. Okay. After that it will follow other study designs, but meta-analysis is the highest. It is the topmost, right? Number one. It has been asked repeated topic, correct? Don't miss this, guys. And then leptospirosis. Okay, it is from micro. So there was an image given that from rats or mammals to humans. Okay, it Leptospirosis can occur from rats to mammals to humans. Actually, leptospirosis comes from the rat feces or rat urine, and when we come in exposure to these rat specimens, we acquire this. Actually, it occurs in rainy seasons, right? And you need dark ground microscopy to identify the organisms. This is very slender organisms, correct? Okay. Okay, I will like to correct one thing, that one I told, that rabies case fatality rate is 100%, and that is Lissa virus type 1, okay, not 2, Lissa type 1. So this one I will have to correct, right? Lissa virus type 1, right? Okay. Now one question came, like, in case of immunosuppression, right, which vaccines are contraindicated? So remember, in case of immunosuppression, like when someone is taking steroids or like that, you cannot give live vaccines. Live vaccine is contraindicated. Okay? So much so that you cannot give his sibling as well. If he is a child, you cannot give his sibling. Live vaccine is contraindicated. Okay? Okay. You can give kill vaccine, but don't give live. Okay. So now we will go to different study designs. So here I will discuss in short. I will discuss everything kiss point, and every point I will be mentioning has come in any of your previous exams, right? So they are very important, and don't miss anything, right? So we'll divide it like this. There are 4 study designs. One is cross sectional, one is ecological, one is case control, another is cohort. Okay. Now cross sectional. From cross sectional we are getting prevalence, right? This has been asked. From cross sectional we are getting prevalence, right? And here individual is the unit of study. This is also important, that here individual is the unit of study. Okay. Now do remember, in ecological, this is important, in ecological, population is the unit of study, and in rest all, individual is the unit of study. Only in ecological, population is the unit of study. Ecology, right? Population. And remaining all, individual is the unit of study. From cross sectional we are getting prevalence. From case control, right, we are getting odds ratio. From cohort we are getting relative risk, attributable risk, population attributable risk, all risks. Okay. Also we know that case control is a backward study, right, from effect to cause. It is for rare diseases. Cohort is for rare risk factors. It is forward study from cause to effect, right? This we know. These are the important points. Also you must know that in one case odds ratio and relative risk is equal. What is that case? For rare disease. For rare disease, odds ratio equals to relative risk. Correct? Again, there is something called nested case control. This has been asked, guys. Nested case control. This for rare investigation. Actually, it is not case control, it is cohort. It's a misnomer, right? It's a cohort study called as case control, but it is a cohort study and rare investigation. It's very expensive, right? This has been asked, right? So now I will go. Yes. Yes, now we will go to an important this one called as let time. Let time is also been asked in your previous exams in UPSC CMS only this has been asked left time, right? So first there is just follow the chart. First there is risk factor, and then there is first possible point of diagnosis, and then there is critical time of diagnosis, right? Critical diagnosis, and then there is usual time of diagnosis, by the time disease will occur, right? So this first possible diagnosis to critical point of diagnosis is your screening time. This will not be asked, right? Don't worry. But the lead time is the longest time from the first possible diagnosis to the usual diagnosis is the lead time. This has been asked, right? So actually this lead time increases the survival period because the disease is diagnosed early, right? You can diagnose at this point itself. So first possible diagnosis to usual point of diagnosis is the lead time. It is the longest time. Okay. Now there are few things I will like you to remember. First, this is about, I'm talking about sensitivity and specificity. This is important, right? You know that. So first, just make a table, right? Here you write test positive, here you write test negative, here you write disease positive, right? And here you write disease negative. Okay. Okay. So test positive and disease positive makes true positive. Test positive, disease negative makes false positive. Means those who are tested positive, they're actually not diseased. Means they're false positive. They're falsely diagnosed as diseased. So they're false positive. Similarly here, test negative, disease negative means they are true negatives, and here false negatives. Okay. So just remember this one: the true positive by disease positive is your sensitivity. Okay. True negative by disease negative is your specificity. Okay. Yeah, this one. False negative by disease, false negative by disease positive is your false positive error rate. This is only for inicet, right? No error it is asked. And just for completion's sake, I am giving false positive by disease negative is false. One minute. Yes, this one is false negative error rate, right? False positive error rate. Correct. Now there is another thing which is important for you, like where should I write this one? True positive by test positive. This one is positive predictive value. Similarly, true negative by test negative, it is negative predictive value. Okay. So how the questions are framed? Like one time they asked, see this question: chance of having disease in test positive. So chance of having disease in test positive, right? Chance of having disease in test positive. What is this? Positive predictive value. This is how they ask. So this table is very important, correct? And even you can use it for solving biostatistic problems, which I will show you in later slides, right? Okay. Now there are a few dictums which I want you to remember. One is like this: screening. For screening we use sensitivity. For diagnosis or confirmation we use specificity, correct? Next we also remember that positive predictive value is directly proportional to prevalence, right? Positive predictive value directly proportional to prevalence, correct? Another is that high false positivity is due to low prevalence, low specificity, right? So this one you remember, and high sensitivity. These to remember, this is very important. Increase false positivity due to decrease specificity, decrease prevalence. Okay? And positive predictive will directly proportional to prevalence. Okay, we have discussed data already. This one, nominal, ordinal, these things we have already discussed. So now we will go to correlation. So see, correlation, right? I will take a new page. Correlation is two types, right? One is linear, what we say as Pearson, and one is curvilinear, what we say as Spearman. So for your exam, this one is important, right? So we said we can name this as R, and denote it as R. Linear or Pearson denoted as R. Okay, and what is this Pearson one? See, this has been asked previously with graph. Okay. I will drop this. Okay, this also. See, this I have drawn this one. Okay, x y axis, right? So let's see if they give something like this. See, this all these dots, they're coming this direction, right? So this is negative, so here we will write r equals to -1. You just follow the graphs, you will understand. This is going uphill, right? All the dots. So here these things is going like this, so you can write r as +1. Okay, these are correlation. In the previous slide we discussed linear or Pearson correlation, right? So this is r equals to +1, this is r equals to -1, and this is r equals to 0. How the graph will look? Ekdam flat. Okay, like this. This is down 1, r -1, uphill r +1, ekdam flat, r equals to 0. Correct? Then there is something known as coefficient of determination, which is measured by r square. Just now we saw r. Correct? If r equals to +1, then 1 square equals to 1. If -1, then -1 whole square, again 1. If 0, then 0. Correct? Okay. Next we will see about the normal distribution curve. This has been asked, a very important thing. Just basic thing. See, first of all, this is the curve, and if you join this, you will do a mistake. This curve will never join the base. Correct? So it will come like this, like this. Okay? Yes. This part will never join. Okay? Never join. First thing. This is the mean. Okay? Then I will draw lines and I will explain it, right? This is +1, this is -1. Okay? Then next one is +2, this is -2, this is +3 standard deviation, this is -3 standard deviation, right? This we all know. Okay? So for +-1 standard deviation, it comes almost 95%, although there are many values and reciprocals this that, but we can take as 95%. For +-2 standard deviation, 68. Okay, no, it's not like that. One second, guys. I'll have it. For +-1 standard deviation is 68%. Okay, for +-2 it is 95, and for +-3 it is almost 99%. Okay, 68, 95, 99. Yes, it's okay now, correct. And there are other features like mean equals to median equals to mode. They all coincide. Okay. Standard deviation is equals to 1. So variance will also be equals to 1 because variance equals to standard deviation whole square. So 1 square equals to 1. Okay. Area under curve is equals to 1. Okay. Is bilateral symmetrical bell shaped tail never touches baseline as I mentioned. Okay. Okay. Now next I will be showing a skewed distribution. Skew. So see, I will show one and you can identify the rest. Always follow the tail. This one is the tail. Always follow the tail. First you write mean, then you write median, then you write mode. Always follow the tail. So tail is in your right side, so it is right skewed. It's clear. Tail is in the right side, correct. In your right hand side, no. So it is right skewed. So all the arrow will follow in the right. Okay. So it is mean, mode, then median, mode, then mode. Right skewed. Easy. And opposite in the left, you can do that. Correct. And don't complex things. This much is enough. And I will show you some. This one is also come. Okay. What is this? This is stem and leaf plot. Stem and leaf. Here only something will be given in diamond pattern. Actually, this is forest plotting. Okay. Here only it will be given like a diamond pattern. This is meta-analysis. Where just now I mentioned the highest study design. No. So meta-analysis can be seen in forest plot only. Okay. If it is given like this way, this is the stem and this is the leaves. Okay. Okay. Next what? Test of significance we have already done. Okay. So now I will discuss about demography. Oh, this is very important. These graphs are asked, right? So just look with me the graphs. First I will draw it. I prepared these slides, these things overnight yesterday, selecting the important topics, right? So I am looking at the important topics and I am discussing with you, right? These are really important. This has been repeated in so many exams, right? So keep attention, right? Colors are also required. So see, in number 1, yes. First, let me write the names, right? So it will be easy. Okay. Let me take this one. Yeah. So first is high stationary. So in this you are seeing that birth rate is also high, death rate is also high. This is high stationary, birth rate high, death rate high, right? So overall things are going in a stationary way, both are high, right? And see in the number 2, which is early expanding phase. Here birth rate is high only, no change, but death rate slowly will come down. Slowly, but you may keep it something like this, slowly it will come down. Okay. Then come the number third, which is the late expanding, right? Where birth rate starts falling, as you can see, and death rate is slow decline. right? Slow decline. Then comes number 4, low stationary, where both are low. Both are low. Okay? Both are low. And then comes number 5, which is the declining, where birth rate is still falling, but death rate is stable now. Okay? Now comes the important point. These are not asked. What is asked is, now I am showing you. Yes. We'll take another color. Yeah. Where demographic gap is maximum. So remember, in this phase, stage 2, demographic gap maximum in stage 2, right? Where it is minimum, demographic gap is minimum in stage 5. By the way, what is demographic gap? Demographic gap is birth rate minus death rate. This is demographic gap. Oh, birth rate minus death rate, right? This is your demographic gap. Okay. So in demographic gap maximum at stage 2 and minimum at stage 5, right? So these two questions has been asked, right? So don't miss them. Also, you can also remember this one. The new CMS, it has been asked in which stage birth rate is what, death rate is what, right? So just I will repeat it once again. In high stationary, birth rate high, death rate high. Okay. In early expanding, birth rate high, death rate starts declining, as you can see. In late expanding, birth rate will fall, death rate slowly decline. In low stationary, both are low. And in stage 5, declining phase, death rate is stable, birth rate still is low. Okay. So next. Okay. So also remember the demographic gift, stage 3, also asked, right? This is demographic gift. That one is demographic gap. This one is gift, right? Okay. So now we'll go towards family planning and contraceptive. As I told you that I will discuss it, in later section. So family planning, right? See, there are 4 things. One is GFR, TFR. This is important for UPSC CMS only, right? This will be asked. This has been asked previously also. GRR, NRR. Okay. So GFR is general fertility rate. General fertility rate. Okay. Whenever RR will come, this means female child. Okay, female child. Whenever general fertility rate will come, means including all children, male, female, all everything. Okay, fertility rate, fertile. How many times she is fertile, right? Like that. Whenever this comes RR, it is number of females. Okay, now I will start, right? Let me take another color. So GFR, it is the number of children a female will bear during her reproductive years. Number of children, mind my words, number of children. So these two, fertility rate means number of children, total number of children. So this includes, okay. So GFR is the number of children female will bear in her entire reproductive years. And TFR is total fertility rate, number of children she will bear in using age specific fertility rate. Okay, this will come in TFR, age specific fertility rate, correct? Now in GRR, same, number of daughters or number of female child that woman would bear using age specific fertility rate. Okay, same in case of another, number of daughters she will bear using age specific fertility rate and age specific death rate. I think it is clear, right? So often these definitions are asked, right, to confuse you. Now what I have to, okay, let me change it again. What I have to achieve. what should I achieve in family planning? What government want to achieve by promoting this family planning? Thing is simple. They want to achieve CPR, couple protection rate. They want to achieve something in total fertility rate, and they want to achieve something in net reproductive rate. What they want to achieve? CPR they want more than 60%. Couple protection rate should be more than 60%. Okay. For that, total fertility rate just now I discussed must be 2.1, and for that NR must be equals to 1. All these are important values. All these are asked. CPR means couple protection rate, means number of couples using contraceptives, newly married ones, right? So more than 60%, this one. Total fertility more than two, this one 2.1, NRR should be 1. Okay, remember the values. Okay, now yes, we must also remember something: intrauterine devices. Details of it I will discuss in gynae, because of course it is the topic of this one only, gynae and obs, right? So here I will discuss something: contraindications and side effects. Okay. So contraindications, I will tell only the absolute contraindications. Pregnancy is a contraindication, but if if a female becomes pregnant with an IUD, right? The thing you should remember that IUD is not teratogenic; it is non-teratogenic. So we will later continue the pregnancy, but we will tell her that it may lead to preterm labor or failure of pregnancy, but we will later continue. But anyhow, in pregnancy we will not give. So pregnancy is a contraindication for IUD. Another contraindication: genital carcinoma. In fact, any carcinoma in genital area, cervical carcinoma also. PID is a contraindication. Okay. Previous ectopic is sometimes, it is relative type, a contraindication. Congenital malformation, contraindication. Okay. And side effects. See, most common side effect is bleed, but most common cause of removal is pain. So just with a few words the answer changes. Most common side effect, bleed. Most common cause of removal, pain. Now IUD may cause PID itself, pelvic inflammatory disease. Organism is actinomyces, just cotton wool pattern. It looks something like, how to show you, let me try. Cotton wool pattern, correct? It looks something like this, exactly something like this in microscopy. Okay. And yes, another side effect is ectopic pregnancy may occur. All right. Next I will go to OCP, correct? This has been asked previously, like, what is this composition of malarial or D? So just remember ethinyl estradiol, because primary composition is this one only, estrogen only, correct? And plus there is levonorgestrel. So ethinyl estradiol is 0.03 milligram, correct? And levonorgestrel is 0.15 milligram. Okay. Plus ferrous fumarate, that one is 60 milligram, right? So this one is the main: ethinyl estradiol 0.03, levonorgestrel 0.15 milligram. And the main mechanism of action is inhibits ovulation. Okay. Inhibits fertilization. This one is more important, right? Inhibits ovulation, right? And they should not be given in DVT. Okay. Okay. Or wherever there is the chances of stroke or thromboembolism, just don't give this. Another thing is Pearl's index. The details about contraceptive we'll see in the gynae session, right? Otherwise this session will be too long. So Pearl's index is, see, this has been asked previously, number of accidental pregnancy by total number of women's exposed, right? Now here if you give years, there you will give into 100, but the moment you give here in months, it will automatically come 1200 because there are 12 months in a year, so it will come as 1200. Am I clear? So Pearl's index is the number of accidental pregnancies by women's exposed. If in years 100, months 1200. Okay, this is a multiplying factor will change. For months it will come 1200, for years it will be 100. Next. Okay, so one question came in your UPSC CMS, like epidemic. What is epidemic, right? So whenever the case, see, first we will understand, for this you have to understand what is endemic, then the concept will be easy. Okay, endemic is the diseases that are already present in our area. Some diseases like cholera, this is common in India, not but in foreign this is not common. I mean, this is already present uh, in our this one in our country. This is already present. And rabies in foreign, there is no rabies. So in our area, if there are 100 cases of these two diseases, then it may be turned to endemic. In foreign, sorry, if in our area there are more than 100 cases, this disease may turn into epidemic. We may say this is epidemic. 1-2 cases in our countries endemic only, the normal only, okay. But 1-2 cases in foreign country, these diseases, this is epidemic. Are you getting my point? Okay. So what is epidemic? When the cases are more than 2 standard deviation or more than 80% of expected. Okay, you say this is epidemic. So what is told, these two diseases in our country is common. So if these cases are more than 100 in area, we will say this is epidemic, otherwise it is endemic only. But in foreign, even one case of rabies or one case of cholera is epidemic. So this is not common in the area, no? Sure. Okay. Dog bite is an important topic. We got 3 questions in inicet, previously from dog bite. So I will divide. How should I divide? 4 parts will be better. First is first what should I take? Pre-exposure I will take. Okay, pre-exposure means before the dog bite. If you want to take prophylaxis, how will you take? Intradermal 2 site. Okay, 0 7 day. Okay, is pre-exposure. Now post-exposure. That is after the bite. What will you do? Intradermal, same, 2 site, but 0 day, 3rd day, 7 day. This has been asked. And another question has been asked, re-exposure. What will you do? See, if more than 3 months, then only we will take. If less than 3 months, okay, already you have been vaccinated, then no need to take. This is the new guidelines. Okay, so for more than 3 months, intradermal again, 1 site, 0 3. These are 2 sites, 2 sites. This is 1 site, 0 and 3. Correct? Clear? And then there's something known as rabies immunoglobulin. Okay, something then known as rabies immunoglobulin. Okay, rabies immunoglobulin is given once a lifetime only. Only once a lifetime. Okay, So remember this. Start, right? So next we will discuss what we'll discuss. Yes, non-communicable diseases 2020. Well, this has been asked. I what to say. I saw this in UPSC CMS. I saw this in neet. Okay, so this is very important. Like this is a program actually. I will divide it in three parts. First, we will decrease something to 30%. Something means not we means this is a plan of government. They want to decrease something by 28%, something by 10%. Right? Of course, our efforts are also necessary. Your own government cannot do. So let's see what is this under. NCD means non-communicable disease 2020 plan. Right? They want to decrease something to 30%. What? What they want to decrease? Salt intake and tobacco intake. They want to decrease these two to 30%. Okay? And they want to decrease hypertension, cardiovascular disease, carcinoma. This they want to and chronic renal disease. This all they want to decrease to 25%. What they want to decrease to 10%? Alcohol, only 10%. Okay, no issues. Insufficient physical activity. Insufficient activity means they want you to do exercise, yoga, like these things, right? So insufficient activity they want to reduce to 10%. This one has been asked, right? So do remember this, correct? Yes, another thing has been asked. Let me find it. Yes. So now I will talk to you about some drugs. So drugs regarding first one is leprosy. Okay. See, leprosy treatment is based on two things. First is possibacillary and multibacillary. We have to discuss about the classification first. Possibacillary less than 6 lesions. Okay. Possibacillary less than equals to 6 lesions. No or one nerve involvement. Okay. And it is just opposite. Multibacillary more than 6 skin lesions and there is more than equals to 2 nerve involvement. Possibacillary 6 months regime and multibacillary 12 months regime. That's all. Now regimes are same in both cases. For children, just make the adult dose half. Okay. So for adult dose I am giving. First is rifampicin. Okay. 600 milligram once a month under supervision. Once a month. Clofazamine 50 milligram daily. Self administer plus 300 once a month, same under supervision. Okay. And Depsone 100 milligram daily. Okay. So rifampicin, clofazamine, Depsone. Okay. For children dose, make it half. And then there are let me discuss about the malaria treatment. Some is Plasmodium 5x, Plasmodium falciparum, which is a algid malaria or dangerous malaria. This one is dangerous, right? Now Plasmodium 5x you can give chloroquine 10 plus 10 plus 5 milligram per kg. 10 in day 1, day 2 10, day 3 5, total 25, ठीक है ना. And then we can give primaquine for 14 days, ठीक है. But Plasmodium falciparum, which is based on northeastern regime, this has been asked, right? Artemether, remember this one, artemether, this has been asked, right? Artemether plus lumefantrine, because this is common in northeastern areas, right? Okay. And here we will give primaquine, but only primaquine for 2 days, okay. Okay, now I will talk you about some government schemes, because this is important for UPSC CMS peoples, those who are giving this time UPSC CMS. So for them this is important, government schemes and these health policies and all, okay. First is Suman. So Suman is Surakshit Matritva Ashwasan, right? This is for all pregnant women. Who are the beneficiaries? All pregnant women, okay? All pregnant women, all mothers up to 6 months post delivery, मतलब postpartum period, ठीक है. And all sick newborns, ठीक है, all sick newborns. चलो next NRC is nutritional rehabilitation center. So this is for same people, I told no, refeeding program for same people, for same children. Same means severe acute malnutrition. I give you the criteria, no, this one, weight for height less than minus 3 standard deviation and all. So for them this is the nutritional rehab center, to gain weight or to gain the mid-arm circumference, and then they will send home, right? Then there is mother's absolute affection, this is to promote breastfeed. When will you breastfeed? Usually it is said that less than 1 hour, but the best answer is as soon as possible after birth, okay. Then there is Laksha. See, Laksha is labor room initiative. So in labor room, what should be the temperature? What should be the facilities? This is dealt under Laksha, labor room initiative, right? Then there is Parivar Vikas Mission. Okay, this you have heard, I think, Parivar Vikas Mission. So in this, this is mainly for family planning purpose. In this, the reproductive woman or the wife is given a choice of contraceptive, or both the couples are given a choice of contraceptive. This is contraceptive. Which one you want to take? They are given the choice to meet the. This is said the government want to meet the unmet needs of family planning, right? Mainly for contraceptive purpose. Chalo. Next is Anemia Mukt Bharat. It's a famous program. Every time it is asked somewhere to somewhere. Anemia Mukt program. So this IFA tablets are given, iron folic acid, where iron is just now I told 60 milligram, correct, and folic acid is how much? 500 microgram, correct. Very nice. This one next, and RBSK. This also I told the deficiencies. Rashtriya Swasthya Karyakram. 5 deficiencies are there. I have already mentioned, right? Okay. Yes. So next I will talk about biological indicator of water. Biological indicator of water. This has been asked in your UPSC CMS. So first one is recent. For recent, you will look for fecal streptococci. This will tell you that the water is, the quality of water. And for remote, you will check for Clostridium perfringens. Okay. Now there is an important thing as levels of prevention. It is also been asked. See, I'll make a table. First I will write primordial. Then is primary. Then, or I will connect this way, and secondary, then tertiary. See, Primordial means there is no risk factor. So I will prevent the risk factor from coming. So this is many lifestyle modification. Means I will tell don't smoke, ride slow. I will give education, health education I can say, right, to prevent the risk factor to develop. And primary is here risk factor is there. I will prevent the disease. So I will give specific protection like immunization, prophylaxis, right? In secondary, here the disease is there. I will prevent disability. In secondary, disease is already there. I will prevent disability. So here we will do early treatment, early diagnosis, screening. This all comes under secondary. In tertiary, we will limit disability because here disability is already developed. We will not allow the disability to spread further. Okay? Here disability is already there. Okay? We will prevent further complications. Right? So next. Okay, now I will talk about few programs. Okay, few programs I will talk about. So first is midday meal. Midday meal program. In this, half protein and one third energy is provided to all school going children to prevent school dropout. Half protein, one third energy. Half protein, one third energy. Right? Don't forget. Then there is two confusion. One is Indradhanush scheme and Mission Indradhanush. See, Indradhanush scheme is for ESI hospitals where they changes the bed sheet in 7 different colors. But Mission Indradhanush is your important area. It is NIS, National Immunization Schedule, which comprises 7 vaccine preventable disease. Now it has increased, right? So NIS is with Mission Indradhanush. Indradhanush, not Indradhanush scheme. It is for ESIs. Okay. Then there is something called Amrit scheme. Amrit is for affordable medicines. Okay? Affordable medicines. Okay? Right. Then there is Jai Vigyan Mission. This is for rheumatic fever, research purpose. Okay? We have discussed biomedical waste. Alright. And now we will discuss something about ESI. It is also important for almost all exams. See. So in ESIs, the share is 3.25% of employer. Okay. Okay, Mike. Yes. 3.25% of the employer plus 0.75% of employee. This is the share. Okay. Remember this, right? And now there are three benefits. One is sickness benefit. Remember the words. One is extended sickness benefit. One is enhanced sickness benefit. So sickness benefit 70% wage. How many days? 91 days. Okay? Means he will get 70% wage for 91 days without any work in case of sickness. It will be extended when in case of 34 diseases he will get 80% wage for 2 years. Am I clear? And enhanced is something else. For tubectomy 14 days, for vasectomy 7 days. Sickness benefit 70% wage 91 days, extended sickness 80% wage for 2 years, enhanced tubectomy 14 days, vasectomy 7 days. Correct? And funeral they will get 15,000 rupees cash. Okay? We are almost at the end, so we are few minutes. We will talk about some committees is also important. First one is Board Committee. So Board Committee, what they did, they talked about public health infrastructure. Public health infrastructure. ठीक है? Next one is Mudaliar Committee. Just find some way to remember it, because what to do. They talked about Indian Medical Service. Mudaliar Committee talked about Indian Medical Service. Next came Chada Committee. They talked about basic healthcare worker. Okay? Next came Mukherjee Committee. Now this has been asked. Mukherjee Committee. What they did a mess. They delinked. So just remember, they did a Mukherjee M for mess. They did a mess. They delinked malaria worker. So malaria program just fell down in that time, because they told malaria worker will be linked from the health worker. So they just dumped malaria thing. Gone, right? Next came Jangalwala Committee. They told a non-practice allowance that is followed in UPSC CMS, right? Non-practice allowance given by Jangalwala Committee. Then came Kartar Singh Committee. Kartar Singh, what he did, he gave the idea of multi-purpose worker, and again male, female, right? Multi-purpose worker. He gave the idea. Then he told that PSC should cover a population of 50,000. Okay? This was a nice committee, right? And then Srivastav Committee. This was also a nice committee. They gave the idea of reorientation of medical education. Then came Bajaj Committee. How will you remember Bajaj is finance? Bajaj, there's a company named Bajaj. So it's for finance mainly. So just remember it as finance. It is enough. Okay, then there is something this also been asked. Community health center, what is the population under it? Remember, 80,000 and 1 lakh. 80,000 for hills, and 1 lakh for plain areas. Okay? And if I say PHC, same, 20,000 and 30,000. 20,000 for hills, 30,000 for plains. Okay? Asha is for 1,000 population. Okay? Subcenter 3,000 in case of hilly, 5,000 in case of plains. Okay? Okay, we are near to the end, guys. The topic I created. Before I complete it, let me give you some datas. Datas are important for your UPSC CMS exams, only for UPSC, guys. So our annual growth rate is 1.2. Okay? Our decadal growth rate is 17.64. Correct? Our sex ratio is 936. Correct? Eligible couple rate is 15 to 18%. Eligible couple rate means where the female is in the reproductive age group 15 to 49 years. Correct? Chalo. Total fertility rate is currently 2.2. Literacy rate is 74%. Right? MMR is currently, it has improved 110 per lakh live birth. Okay? IMR is 32 per thousand live birth. Okay? HDI is 0.647. Correct? Okay. Okay. Another thing is left. Is an important thing, dependency ratio. This has also been asked in your UPSC exam, last UPSC exam. Dependency ratio. Okay. So number of people which is less than 14 years means children. Children are dependent, and adults means elderly are dependent more than 65 years. So below 14 years number of persons, more than 65 years number of persons, they are dependent, right? Upon whom? Upon this age group, 15 to 64 years, because these are the working group, right? Into 100%. This is how we calculate dependency ratio, and India has a dependency ratio 54%, right? So remember it. And yeah, so and yes, few formulas are there. You also remember these formulas. Coefficient of variation equals to standard deviation by mean into 100. How will you find the standard deviation? Root over summation of x minus x bar whole square by n. If n less than 30, then it is like that. If n more than 30, then n minus 1. Anyway, x is the arithmetic mean. Okay. And yes, coefficient of determination we already mentioned, r square. And then there's another thing like degree of freedom. Degree of freedom is rho minus 1 into column minus 1. What is rho? What is column? Well, this is row, this is column. Okay. This is row, this is row, this is row, this is column. Okay. Okay. तकरीबन तो I discussed everything, whatever is necessary. Yes, one thing is left. See, specificity and positive predictive value. Okay. In case of parallel test and in case of series test, how these things will change. In case of parallel test, specificity will reduce, positive predictive value will reduce. Okay. Remember the things I told you earlier. False positivity is inversely proportional to specificity. Okay. So what do you mean by parallel test and what do you mean by series test? I will tell you this after this slide. So for now, you just remember, for parallel test, specificity decreases, positive predictive value decreases, and for series, just opposite. Okay. Now let me tell you what is parallel versus series. Series parallel means what? I first gave you, say, a sputum test. Then you came with the report, I gave you chest x-ray. Then you came with the report, I gave you CBNet, like this. For example, right? This is a parallel test. Series means what? I gave you all together. Sputum plus chest x-ray plus means something or something will come positive, no? So series is highly specific because here the chance of getting positive is higher. यहाँ पे तो sputum negative आ सकता है. Then this may come negative, then you will go for another test. But here you are giving 5-6 tests together in series, so this is for confirmatory, and something will come positive out of all this depending on the symptoms. This their specificity increase. Now come back to the previous slide and see whether our thing is okay or not. See, so series specificity increase, as I told. Yes, see, because in series you are giving 5-6 tests all together, something or something will increase, right? So specificity is highly confirmatory, specificity increase. As I already mentioned, for confirmatory thing is specificity, for screening is sensitivity. Okay. Okay. And now we will discuss one last topic. This has been repeated twice. Okay. In your inicet. I have to see the graph first. Yeah. So I need two colors. Uh, just pay attention, guys. This is a bit tough, right? Health. See, this is healthy. Okay, this is the cutoff. This one is the cutoff. The graph goes like this. This is the first graph which I drew just. Okay. This color, this color. So they keep something like this. This one is the healthy, this one is the cases, and this is the cutoff. Now this was the first test. The first curve that I drew just is the first test, and this is your second test. Which one is, uh, you know, they asked about the second test. Means they asked about the second test. In second test, what are the changes that happened? See, the first test, these are the healthy population which have been, misdiagnosed a disease. So actually, this is false negative. I am talking about the first test, this one, and these are the false positive. Okay, na? Healthy cases taken as disease. In the first case is a huge number. So healthy cases when taken as disease is false negative, and cases so these are diseased only. Disease. Now see, when cases are misdiagnosed, they become false positive. So when this second test came, okay, just notice guys, this false positive has decreased, right? Here false positive is more, here false positive is less. You see that? So false positive decrease, and just now I mentioned that false positive is inversely proportional to specificity. So false positive decrease means it is highly specific, is not it? Okay, na? Healthy cases misdiagnosed as diseased because of the cutoff, they are the false negative, and cases misdiagnosed as healthy, they are the false positive ones. In second test we clearly see that the false positive is less, and as I mentioned, false positive is inversely proportional to specificity. That means decreased false positive means highly specific. So second test is highly specific. Okay, so these are the topics that I wanted to discuss with you, and I think I've discussed all the major points. So thank you, and join to my channel if you want to know something new or something more about any topics. Comment and also join, right? And let me know, because I am just throwing the light depending on my views. I'm not getting what you actually want. So if you just comment me that we want this or we want image based, so I will add accordingly, right? So you have to guide me through this, right? That what you actually want, and if it serves then it's okay, then I will go like this, right? So anyway, thank you and stay joined, right? Okay, thank you.